in bringing that specialty to KOLKATA Medical Center. Congratulations to the entire team, senior team over here. If we see the outcome of any be it a neurotrauma or a neuro accident, it is the team which makes that difference and makes that outcome, which is different than what 20 years back used to be. CK Birla Group of Hospitals, be CMRI or BM Birla, were always focused on bringing that value, that differentiation to the city. Now, this session, 1.5 day session, the seminar, is specifically focused to neurointensive care. And that includes the neurointensivist, the neurosurgeon, neurologist, maybe physiotherapist, the neuroscience, neuro-nursing candidates, and they as a team, how they perform, how they work together and make difference in the patient's life. So on behalf of CK Birla Group of Hospitals, I invite all of you, I welcome all delegates who have come from different parts of the country, and I'm sure in coming 2 days we'll be having wonderful sessions, scientific sessions, which will be beneficial for uplifting the neurosciences activity in this part of the country and country as a whole. Welcome once again. Congratulations to the organizing team. Thank you very much.
Thank you, sir. Our neurosurgeon from Trichy and a very dear guest, Dr. Ramapurushan. Could I please request you, sir, to come and share a few words of wisdom with us?
Thank you, Dr. Prusty, Dr. Mala and Vidya. We've been very close friends for a very long time, right from the days we shared in the men's. Dignitaries on the dais and all the guests, faculty members. It's a pleasure to have come all the way from Trichy to this meeting. See, the problem of neurology and neurosurgery is that there is a lot of hope among the patients that the doctors are going to work wonders. Whereas among the medical community itself, I think there's a lot of despondency. People think that, okay, if you become a hemiplegic, you're going to remain hemiplegic all your life. That's how the movies portray it, The person, it's a very common scene to see a patient with a stroke going around with a limb all through his life in most of the movies. So, is there a way to change the scenario? Has the scenario been changing? I think in our own lifetime, now we've lived a long enough time in this field of neurology and neurosurgery to see a tangible change that has occurred in the prognosis of the patients. And what has contributed to this is that the concept of an individual doctor caring for an individual patient has changed to a team care. I think that is very, very important because we are able to bring in a lot of inputs which your training does not expose you to. Like for example, if you are a neurosurgeon, you may not be as familiar as a neurointensive care person with some of the aspects of physiology of the brain. So having a person like that with you to manage the patient is a distinct advantage for the patient. And I think that is where we've made a lot of difference in the last 10 years. The other thing that has happened is technology has improved, but mere technology is not enough. You will see in the next 2 days that it is the application of technology that's more important. Just because you have a machine, it doesn't save lives. It is the fact that you have to use the machine properly, and you have to bring the best out of the machine, and that is where lives are saved and the morbidity is reduced. I think this conference will focus on how best to do that, and I'm sure the next 1.5 days will be. See, and in any conference, it's not as if the faculty members come and speak and they just give their. It's not a one-day process. It's a process of interaction. I'm sure you people have developed a lot of expertise of your own. We would like to hear from you what you're doing with your patients. So I hope, at least in this meeting, which I've been saying in every meeting that I go to, that there will be as much time for discussion as there is for the talks that are given by the experts. I wish this conference well, and Dr. Prusty, you've done a great job. Dr. Saswati Sinha, you've also done a great job in organizing this. Thank you for inviting me. Thank you.
Thank you, sir. Dr. Radhakrishnan, Neurointensivist, Levance. And a guest, sir, could I please request you to come up?
Good afternoon, everybody. It's my pleasure to share the dais with the senior neurologists, neurosurgeons, and the CEO. It's a surprise for me because the last time I visited this town was 10 years before. And that time it was KOLKATA, now it is KOLKATA. So there's a lot of changes I could see, and the changes are also happening in the neurosciences specialty. And normally when you see the intensive care topics, it will be just either 1 or 2 sessions or just 1 or 2 topics in any conference, either organized by the Anesthesia Society or the Neurosurgery Society. But here, the entire CME program is dedicated to the neurointensive care management of both neurological and the neurosurgery specialty. And I think I should appreciate the neurosurgeon Dr. Prusty for organizing this neurointensive care. So this shows the importance of this subspecialty. In fact, in our institute, we are starting the PDF neurocritical care. It's a 1-year course sponsored by the ICMR from this year onwards. So I request Dr. Prusty to continue this CME rather than just a CME as an update in neurointensive care annually or biannually, so which will help all the neurology, neurosurgeons and the intensivists to get update with this specialty. Thank you.
Thank you, sir. In fact, before the session, I was just talking to one of my doctor friends, and I asked him that what inspired you to be a neurologist? And he said that I wanted to be a neurologist because that seemed to be the most difficult, most integral, and most important aspect of medicine, which had links with psychology, aggression, behavior, and human affairs. So, ladies and gentlemen, this today we'll be having, in fact, a mind-boggling session with all the experts. They'll explore various areas of neurology and the advancement in the field of neurology as well. Now, may I request Dr. Saswati Sinha to please deliver the vote of thanks.
Pleasure to welcome all of you to our endeavor to bring about the specialties of neurology, neurosurgery, intensive care, nursing, physiotherapy, and all other allied specialties under the same banner. We really look forward to an academic feast over the next 1.5 days. I would like to thank each and every person who is present here. I would like to thank the management, Mr. Dr. Singh, Mr. Barar, to allow us and to guide us through this journey to organize the conference. I would like to welcome the external faculty, all my seniors over here, and everybody present. Thank you, Lydia, for anchoring. Thank you, Mr. Mario. Thank you, Anindita, for the wonderful song. And I welcome all of you to the city of KOLKATA. I'd like to invite all of you to join us for lunch. And we resume the academic session at 2 p.m. Thank you very much.
Now, many of my friends from the media are here, so in case if you would like to have a press briefing, we can do it here itself in the auditorium. So my friends who are there from the media.
Shyam. Neurodisease, yeah, that's a very, very common, problem. When there is a patient come with trauma or patient come with brain trauma, then they come to unless until there is a collaborative
তুরন্ত সেটা বুঝতে পারবো মানে দ্যাট ইজ দ্য থিং উইল রেকগনাইজ না এবং সেটাকে আমরা বন্ধ করে দিতে পারবো এই হওয়ার দ্বারা আমাদের এই যে পেশেন্টের আউটকাম যে পেশেন্টগুলো আদারওয়াইজ উড হ্যাভ লস্ট সেই পেশেন্টগুলো আমরা সেভ করতে পারছি ফর এক্সাম্পল হেড ইঞ্জুরি আমরা জেনারেল ওয়ার্ডে ট্রিটমেন্ট বা জেনারেলাইজড ট্রিটমেন্ট করলে যে মোর্টালিটি রেটটা আগে ছিল কিংবা যে পেশেন্ট খারাপ হতো আজকে দিন এই ইমপ্রুভ কেয়ার দেওয়ার জন্য সেই পেশেন্টগুলোকে আমরা খুব শীঘ্র মানে অনেকটা মানে 40 থেকে 80% পর্যন্ত আমরা ইমপ্রুভমেন্ট করেছি, যেটা আগে 40% ছিল সেটা আগে 80% হয়ে গেছে। সেরকম ব্রেন হ্যামারেজ পেশেন্টে ইন্টেনসিভ কেয়ার দেওয়ার দ্বারা আমাদের যে মরবিডিটি মোর্টালিটি রেটটা অনেকটা কমে গেছে, অলমোস্ট 5% কম হয়ে যায়। জিনিসটা ইমপ্রুভ করেছি, অনেক লোক বাড়ি যেতে পারছি।
আগে এক্সিলেন্স হয়ে যাবে, বাট ইনিশিয়ালি প্ল্যান করছি গ্যাস্ট্রোএন্টারোলজি, তারপরে উইল ডু অর্থোপেডিক্স, তারপরে নিউরোলজি, তারপর মাদার অ্যান্ড চাইল্ড কেয়ার। তো এক একটা করে কেন ইট টেক্স লট অফ টাইম, লট অফ এফোর্টস টু মেক ইট হ্যাপেন। তাহলে আগে নিউরোলজি গ্যাস্ট্রোএন্টারোলজি হচ্ছে দ্য সেন্টার অফ এক্সেলেন্স হবে। বেস্ট পসিবল ট্রিটমেন্ট, বেস্ট পসিবল ডক্টর্স, বেস্ট পসিবল আউটকামস অ্যান্ড রেজাল্টস উইল বি দেয়ার উইদিন 3 months, you will see. And তারপরে we will do ortho or mother and child.
এখানে নিউরো ইন্টেন্সিভ কেয়ার কি আপনারা সিএমআইতে শুরু করেছেন?
নিউরো ইন্টেন্সিভ কেয়ার আমাদের সিএমআইতে ফার্স্ট ছিল ইন ইস্টার্ন ইন্ডিয়া, ওয়ান অফ ইটস কাইন্ড। যখন শুরু হলো নিউরো ইন্টেন্সিভ কেয়ার, দ্যাট ওয়াজ দ্য ফার্স্ট নিউরো ইন্টেন্সিভ কেয়ার অফ ইটস টাইপ ইন ইস্টার্ন ইন্ডিয়া। অ্যান্ড দ্য কেয়ার ইজ রিয়েলি টু গুড। বেস্ট পসিবল ইকুইপমেন্ট আছে আমাদের কাছে, বেস্ট পসিবল ডক্টর্স আছে। আই শুড নট বি সেইং, বাট নাম্বার অফ হসপিটালস থেকে যখন দে আর আনএবল টু হ্যান্ডেল, ওরা এখানে পাঠিয়ে দেয় যে সিএমআই পাঠিয়ে দিন, আর আমরা পাচ্ছি না, এখানে পাঠিয়ে দিন, ঠিক হয়ে যাবে। দ্যাট সর্ট অফ থিং। তো দ্যাট স্পিক্স ভলিউম about our neurointensive department. Secondly, most of the doctors, they want to be admitted here. That also speaks volume, because doctor জানে কোথায় ট্রিটমেন্ট ভালো, কোথায় আউটকাম ভালো। So that is the ultimate sort of what to say, a stamp for us, যে হ্যাঁ আমাদের ডিপার্টমেন্টটা খুব ভালো, ভালো চলছে, ভালো কাজ করছে, রেজাল্টটা খুব ভালো।
लेकिन सब पेशेंट जो बोलते हैं वो देखने में प्रॉब्लम आ सकता है, उल्टी हो सकता है, हेडेक हो सकता है, तीनों प्राइमरी सिम्टम कोई भी न्यूरोलॉजी का प्रॉब्लम है। इनिशियल कोई सिम्टम होता है, आप नेसेसरी अच्छा होगा कि न्यूरो कंसल्टेंट और स्पेशलिस्ट को मिलना चाहिए, बिकॉज हमारा एमबीबीएस लेवल क्या है, डॉक्टर लोग का या न्यूरो का
It is the team which makes that difference. So when we talk about neurointensive care, it is the whole gamut of activity which we do in that intensive care. The neuro patient, they have specific needs, and that specific need can be fulfilled by the team of professionals, and how those teams are working together, that makes difference. So we at CMRI, one of the oldest and the first of Western part of India, which has started neurointensive care in Western part of India. With time, we have got expertise and amalgamation of those specialties together. We are trying to strengthen, we are continuously strengthening the technology part of it, the human capital or the various professionals who are giving services at neuro centers, be a nurse, be a physiotherapist, be a technologist.
What is the plan?